Bob, thank you very much, and Dr. Campine, thank you. I'm glad to be in your institution. At my advanced age, nearly all I get asked to do anymore is to give memorial addresses for my friends who have died in the past. This makes the 22nd memorial address I will have given in 12 years. Not all of those had been friends of mine, but certainly Dr. Ernie Henschel had been, and most of them had been. I think I knew Ernie quite well in the SAC, Society of Academic Anesthesiology Chairman, and associated with him in that for several years. I believe today Dr. Henschel would be very proud of his department if he could see to what heights it has risen. Dr. Campine and his associates have really made it. Most of you are his associates, so I'll have to tell you it's really an impressive department. And I think Dr. Henschel would have been very proud of the developments which have come about. In addition to memorial addresses, for some reason, things which were no accomplishments of mine, I've been asked to talk about personal experiences on the weekend, that tragic weekend in November, 30 years ago, and that's what Bob Kettler asked me to do today. And I appreciate Bob's asking me. He was an excellent resident in our department, and we regretted seeing him migrate back northward. We thought he did pretty well to withstand August in our city for 4 years, but he's come back to the glacier area, and I think he's balancing his physiology out over this time. Before I go into the actual happenings, I think I would ask you, did you see the movie JFK? How many? Let's see how many saw it. Do you know that was a documentary? Did you think it was a documentary? Well, I'd like to spend a little time on it because I was in it. In some opposition to my good senses, it was correct in two issues. It had the date right. And it had the identity of one killed right also. Beyond that, things were pretty elastic as far as the truth was concerned. My wife had ovarian cancer in 1991. That was in her 3rd of 4 years that she lived. We'd been going to the National Cancer Institute in Maryland for treatment. And we came home one Friday, drove back home, and found our daughter from Hollywood, Los Angeles, where she lives. At home, we didn't know she was there. She said, "Dad, I've got a job for you. I've acted as your agent. You're going to be the technical advisor for Oliver Stone's movie JFK, technical advisor for the resuscitation scene." I said, "Christy, I'm not going to do it. I've been reading about that, and he's developed a theme of the district attorney who's been discredited from New Orleans, the one that what he is basing the movie on." I said, "That was all wrong." I said, "Why do you want me to do it?" And she said, "I want to meet Oliver Stone." So I did. So on Sunday I went to Fort Worth, where they were setting up in operating rooms in the old St. Joseph Hospital, old operating rooms they weren't using. And the set designer, Crispin Salas, an Englishman who's been acclaimed for his set design, assured me that Oliver Stone is absolutely a stickler for detail, for authenticity. It must be authentic. And for that reason, I've taken over pictures of the trauma room, which has since been torn out of Parkland, and also took him a list of equipment which he sent back over and brought some of the artifacts that had been in that trauma room, which had been outmoded and moved out, and I had claimed them over the years. And so over a day's time, with 40 people working, and put different tile on the walls, different tile on the floor, a new light in the ceiling, new electrical fixtures on the outside of the walls, and it looked very much like that trauma room. And he assured me it has to be authentic because Mr. Stone had had a new facade put on the school book depository. a 7-story building. He had built the facade to look like it did 28 years ago at that time. I got there the next day for the filming. I was a little late, and one of the attendants was putting real blood, RWL blood, false blood, over everything in the room and over everybody in the room. I said, Mr. Stone, this is wrong. That's absolutely wrong. There wasn't blood on anybody, except on Ms. Kennedy's coat. You saw that pink coat with the blue velvet lapels she had. She had blood on it, and incidentally, the young lady playing a part of Ms. Kennedy was a very attractive young lady and dressed just like Ms. Kennedy had been. And when the camera would swing toward her, she just cried like everything. And this camera would swing away, and she was bright again. Swing to her, cry, swing away, bright. That wasn't authentic, but I didn't point that out. So I said, well, no blood on that, blood on her and on me, because I was standing against his head like an anesthesiologist should, with a finger where the temporal pulse should have been, a hand on a bag at that time. And I said, there's blood every time I squeezed his chest, blood gushed out and went down my front end of my shoes, but that wasn't, nobody could see that. I knew it. So there wasn't blood on anybody. And Mr. Stone said, oh, Doc, people expect to see blood. So much for authenticity at that point. I was trying to direct the people around the man playing a part of Kennedy about how you do a tracheostomy. They were hams, just been hired, extras. One of them was president of an insurance company in Dallas. I knew older than I was. I said, Austin, what in the world are you doing here? He said, I always wanted to be in the movies. So trying to tell them how to do a tracheostomy, how to put a chest tube in, how to catheterize the bladder, how to start IVs. And Mr. Stone was getting very tired of that weight. He said, oh, Doc, get up to the head of a table and do what you did 28 years ago. And I thought, well, that's all right, I'll look the same. So I did, and that was a brief scene, and we went to the movies. Oh, I'll finish that. I got for that morning's work a eligibility for a SAG card, Screen Actors Guild. And that was the first time my wife and my daughter decided she wished she hadn't recruited me to do it. It took her 3 years to get a SAG card, and I got one morning. Anyway, we went to see the movie sometime later, and I was asleep when it reached that point. My wife jabbed me, there you are, there you are. And I said, where? And I was gone, so I never did see it. But I'm told it was in black and white, so it didn't matter what color tile we had on the floor or anything else. Well, that's quite apart from what I'm to talk to you about, but I thought I would interject that because so many of our younger people think that was a documentary. And it was not a documentary. It was controversial to accept the district attorney's view. He's been discredited so much about what his view was, and so it lacked authenticity. But I guess you couldn't publish a book today if you agreed with the Warren Commission report findings. You've got to be controversial and disagree with it. Which brings me to the point that today in the Library of Congress there are over 1,000 books on the assassination. And probably 3 of them agree with the Warren Commission report. And the rest take up some other theories. And I heard a new theory today. I won't go into it, but hear about what the conspiracy was and who did the shooting and such. Well, let me show you a few pictures. We do need to dim the lights, Greg, I believe. Not many pictures because I suspect, well, this doesn't show up in this dim light, but it's, I mean, it's bright light. That's all right.
No, we can show you right up there. There's a dimmer right up here.
Well, I'm sorry, I don't see that.
No problem. This device right here will dim.
Oh.
You just do this when you want the lights dim, and then you bring it back up. It's the left-hand one.
All right, thank you. I failed to get checked out in the machine here. This is in Parkland Hospital today with a picture of Mr. Kennedy and Mr. Johnson, and statements that Parkland was the center of Texas government since our Governor Connolly was in the recovery room at that time after his operation. And Mr. Kennedy died there, and Mr. Johnson was there and sequestered in another room at the time. In downtown Dallas, we have two historic spots, particularly historic, and this is a cabin occupied by the settler of Dallas, the first settler there on the banks of the Trinity River. Now, you understand water with a lake right out here. We understand water. The Trinity River in Dallas, you can tell where it is by the dust the catfish kick up. On the other side of that plaza from Bryant's cabin is the memorial, the Kennedy Memorial, which was designed by Philip Johnson, an architect chosen by Ms. Kennedy. I'm glad Ms. Kennedy had chosen him because that quelled any criticism of whether this is a fitting memorial or not. It has a little of the looks of the Gandhi Memorial in New Guinea, except the Gandhi Memorial is less high than this. And in the interior, in the center of this memorial is this John Fitzgerald Kennedy and an inscription across the top. And it's within sight of our city hall that's tilted over. It looks like it's going to fall. We keep expecting it to, and we hope it takes the appropriate number of politicians with it. Well, to review, this is a young audience, and not very many of you remember the circumstances, but contrary to what the papers want to report, Dallas being a city of hate, the city had turned out with great, as they should for a president, regardless of whether you agreed with the president or not, with great enthusiasm, a warm welcome. And the route that the car was coming, carrying the entire presidential motorcade from our airport, which was a downtown airport at that time, down to where they were going through the city and then back north to where they're having lunch. The motorcade came down a street over here, turned on this one, turned again, and this is to go under the triple underpass. This is a school book depository, and as the motorcade turned here, as it reached about this point, there were 3 shots within 5-second intervals of each. So 3 shots were accomplished in 10 seconds. And the first one probably went astray because this picture doesn't show the height of this live oak tree here accurately. But Oswald was firing from the 6th floor window through that tree for the first shot, and probably the bullet hit a branch and ricocheted and was never found. The next 2 shots did come down this way. One went through the president's neck, out through right below his larynx, and right under the knot of his tie, and then through Governor Connolly. And the 3rd shot was the one that hit the president in the head. I'm making this very brief about the detail, just to give you the facts as we know them as they occurred. And then I come back to talk about personal reminiscences. As the course of the bullet through the president's neck, he was leaning a little forward, and the angle of the bullet is one that did subtend to the 6th floor window at that corner of the school book depository. And it had come in just about at the 7th cervical vertebra transverse process, and had come out of his neck right below the larynx. It was confusing at times for people about whether this is a wound of exit or a wound of entrance. You know, part of the controversy today, well, he's shot from the front. For several reasons people say that. Most reasons incorrect on a ballistic standpoint. Others incorrect just because it's impossible to have got that angle and not have been in the car to be doing the shooting to begin with. And this is a bullet which came through, which then, well, let me back up a bit here. Some of the controversy comes from a standpoint that the holes in his coat didn't jive with the holes where the autopsy said the bullets had come. And that's formed some opinions, conspiracy opinions. There were more shots that penetrated the president than really did. But considering two factors, first, his coat rode up, and I'll show you that in a subsequent picture. And the second, this doesn't demonstrate it quite well, he was already developing a dowager's hump from excess steroid use combating his Addisonian status. And he was cushion-eyed part of the time, as those of you who remember seeing him on TV. At times when he was under stress, such as Bay of Pigs, he had the moon face and the heavy eyelids and swollen eyes, characteristic of the cushion-eyed patient. And so there's no way to jibe the holes between his coat and those that came through him. As we see here, this is a picture made right before that with a hump in his coat and his arm up on the side of the car. Incidentally, these pictures I've taken out of the book by John Latimer. Latimer is the retired chairman of urology at Columbia Presbyterian. He's also a ballistics expert, and he's also an assassination buff. He's written an excellent book, and if you're interested in assassinations and looking at all the evidence of who did it, get his book called Lincoln and Kennedy, because he's investigated both of these very thoroughly, and I subscribe to his thesis on this because he subscribes to the Warren Commission, and the evidence all points to that having been correct. So this came from Dr. Latimer's book. And as he shows in this also from him, that this bullet, which was a 6.5 millimeter bullet that was 3 centimeters long, which fit the Mannlicher Carcano rifle, as it came through, it's a powerful rifle and a powerful bullet too. This started deflecting it, so it started tumbling, as a bullet going through something first would do. And by the time it hit Mr. Connolly in the side, right side, just lateral to his scapula, it was upright, and there was a 3 centimeter incision, 3 centimeter wound where the bullet went into his back, measured out by the thoracic surgeon who did the operation. So evidently the bullet had turned to that point. Many of those who disagree with the Warren Commission report say that there's no way, well, the movie JFK, there's no way that bullet could have gone through Mr. Kennedy and then gone through Connolly without having turned and gone a different direction. We're looking at the fact as if Mr. Kennedy and Mr. Connolly were statues, rigid statues sitting there, and that would be true had they been rigid. But the Zapruder film shows that Mr. Connolly had turned. Evidently he had turned as he heard the first bullet. Turned to look at the president. He turned in order to look back right directly behind him, he put a hand on one thigh and leaned to his left and turned. And that put him in the line of fire, so he was hitting the right side. Bullet came out right under the right nipple, went through his wrist and lodged in his left thigh. This essentially was the wound entrance for the head injury, about 2 centimeters to the right of the greater occipital protuberance and about 4 centimeters up, which blew out a large segment of his skull in the temporoparietal area on the right, about the size of the palm of your hand, about 5 inches, 13 centimeters across. And from reconstructed from his Zapruder film showing areas, what way the skull segment went, these are areas of brain tissue which the motorcyclist following along next ran into. And the last thing that I would show you here, because these represent some of the controversies, people saying, well, that rifle was not good. It was a potent rifle. It's a very powerful rifle, according to the FBI and according to Dr. Latimer, who owns 4 of the rifles himself. and has fired more than 600 rounds of from the same lot from the Western Cartridge Company that Oswald had used. And people saying Oswald wasn't a good shot. Well, here's from Oswald's Marine Corps record, in which he put on one day at 200 yards without telescopic sights, put 49 of 50 shots in the target. That's roughly a silhouette of one's back, head and back. And 2 days later put 48 of 50. Well, in Marine Corps marksmanship, 48 and 49 of 50 at 200 yards is not a very good shot. But I think it's an adequate ability to use a rifle that he could do that. And certainly from the school book depository to where the car was at the time his firing was less than half that distance. Plus he had a telescopic sight. Last thing I show in pictures is I was there for Oswald two days later, and we had plenty of time to get set up to wait for him because they couldn't get the car out of the basement of the police department. This is made sometime later. It shows a narrow passageway where the ambulance carrying Oswald had to come out, but there's so many newsmen here that they couldn't get out. So we had a lot of time to get set up for it. Well, those are the facts of the case as they are, and now I'll talk personal reminiscences, which brings out some other aspects of it, I think. On that Friday at noon, I was sitting in the dining room at Parkland Hospital with a number of other staff from anesthesiology and from surgery and the OR supervisor, and I came crackling over the loudspeaker, Dr. Shire is stat, Dr. Shire is stat, Dr. Shire is stat. Unusual call, because Shire is with our chairman of surgery, and they don't page chairman of any departments over the loudspeaker system at Parkland, nor do they ever call one stat. And here was coming Dr. Shire's stat. So one of the surgeons got up and answered the phone. Dr. Shire was in Galveston at that time at a medical meeting. We knew that. So the surgery resident, Ron Jones, got up, answered the phone, and came immediately back to the table, looked blanched and white, and said, "The president's been shot and they're bringing him here." With that, I shouted to Buddy Giesecke, one of my staff, to go to the operating room and bring down an anesthesia machine, and I tore out through the dining room and down a back stairs, just one flight, to the emergency room. I wanted an anesthesia machine if we're going to have to do something very significant, because I was more familiar with it, although I knew each of the trauma rooms and emergency room was set up with ventilatory apparatus. Had a Bennett ventilator in the room where he was brought, for example. As we were sitting there that day before we got this message, well, put it on a personal note, we were sort of grousing about what we were having for lunch. I was pushing salmon croquettes around on my plate, and salmon croquettes in county hospital, or at least our county hospital, weren't very good at best. And we were grousing about here us non-Catholics were eating Catholic food. And the president and his entourage were going to have barbecued beef at the Apparel Mart. And we thought maybe he had got dispensation from the Pope to eat barbecued beef, and why didn't the Pope give the hospital a dispensation to have one of these salmon croquettes? Well, that was the tone of our conversation until we got this message that the president's on his way. I knew then something was very wrong, because the sirens, the ambulance sirens or the police department sirens, they're supposed to turn them off at the street before turning to go around the hospital. And here you could hear any number of sirens screeching clear around the hospital. I reached the emergency room just in time to fall in behind the gurney on which Mr. Kennedy was being transported. Secret Service 3 or 4 on each side, being led by a nurse to a trauma room. As we reached that room, the Secret Service just shoved the gurney in, and they stood like a cordon like that right in front of the door. to block anybody else. They were protecting the president. They hadn't protected him very well up to that point, and I guess they felt like they'd better keep any enemies out, but they didn't know whom to keep out or what. Fortunately, there were two doctors already in the room. Dr. Jim Carrico, who's now chairman of surgery there, who was a third-year surgery resident, who had just had a 3-month rotation on anesthesiology, I'm glad to say, and Dr. Dick Delaney, a urologist, who practiced urology in Dallas now. They're both residents. And then the time that I was blocked, and then they stood aside. They did that for everybody coming. I just blocked the door and stood aside, not knowing whom to keep out or what. By the time I got there, Jim Carrico was just taking a laryngoscope out of the mouth. He put a tube in. I was pleased that he did, and told me as he handed me the laryngoscope with the tube sticking out, he said he has a big hole in his trachea. I later wondered how he knew, because he still had the tie on, his shirt on. But Jim said he has a hole in his trachea, and I hope I pushed the cuff down far enough that it'll occlude it. And then he ordered 300 milligrams of hydrocortisone. I remember thinking later, well, Jim's pretty smart to remember the stories about the president being Addisonian and needing steroids, and this was certainly a traumatic emergency circumstance which was justified. Well, that's how we started. I connected the Bennett up while we were putting EKG on. They were starting IVs, checking his chest. Couldn't hear breath sounds on one side. It might have been because we had a good leak back from the other. Started putting a chest tube in. Surgeons arrived and started to decided, well, with bubbling coming from his trachea, didn't know what else it was around the wound. By this time, had his clothes cut off of him. As happens in an emergency room, in a real emergency, somebody cuts everything off so you can see what needs to be done. And as they started the tracheostomy, well, reports were that there was a lot of confusion in the emergency room. I'd have to say there wasn't confusion on a part of the medical team, because as people arrived, came into the room, they could see where around the prostrate figure of the president they needed somebody to do something. And then beyond that point, they stood back. Didn't need any direction for that. We had 2 people doing a trach and another compressing his chest, one putting a catheter in the bladder, 2 others starting IVs in the leg, and one at one arm. And then I was there, and had another anesthesiologist, Buddy Giesecke, still had come down with a machine, anesthesia machine, which I now put into tracheal tube to respire for the president. So these things went orderly, I thought, expeditiously and efficiently, and I've been asked a lot of questions about this that time. They said, wasn't the president dead when he arrived in the emergency room? Excuse me, I'm hoarse. We had a cold day last week, and I got a sore throat from it. My answer to that has been, well, we see a lot of patients who look as bad as he looked, who arrive in the emergency room, who are treated, who walk out a few days later apparently without any mental deficiency. But these are the ones who don't have a head injury. And he had the head injury, which was not immediately apparent to other people coming into the room. How he looked, he was cyanotic, deeply cyanotic, pupils widely dilated, conjunctiva suffused, and an agonal type respiration. You know the agonal, the mylohyoid group. The first muscles that act in utero, and the last, following the usual laws of phylogeny, the last ones to go out as one died. The chin jerk that goes with the spasmodic attempts at agonal ventilation. He had these, and on EKG, a dying heart pattern, that when we slow loping dying heart pattern, but when we ventilated him with oxygen, there'd be semblances of a normal rhythm come back, and we could see some cardiac activity. So no, he wasn't dead, but he had this big brain injury, which would indicate that he was non-resuscitatable. Well, people were really working at it. As we read, if you hear quotes from many of the team who were around there, you'd think that everybody examined his head wound in great detail and explicitly while doing a resuscitation. That wasn't true. I think that I would say this without disrespect for our surgical colleagues. Surgeons see things in tunnel vision. They look at what they're working on, and they don't look at very much else. And as they came in, they were all surgeons. They came in to do things. They took care of what they were doing and didn't inspect beyond that. The president had a real shock of hair, and it was blood, matted with blood. And he was a big man. His feet were off one end of the gurney, his head off the other, or at the end of the other, and I was standing against it. And I believe people coming into the room, were, since the feet were toward the door, were not aware as they came in that he had a head injury. He was just bloody, that was all at that point. Or brain injured to that extent at least. And so we went through this process, resuscitation, closed chest, starting the fluids, putting in the chest tube for thinking because he didn't get breath sounds over there, that he had a pneumothorax. And until, well, I'm getting ahead of myself. I think I ought to tell you what my thoughts were at the time. People asked me, well, did you think of this as being a president or just an ordinary patient? Well, it was impossible to think of it as an ordinary patient. It was possible to think I was a president, but it's almost impossible to think that it could be the president here who had been assassinated and had these injuries. So I know my thoughts as they occurred. They were not grand thoughts at all. I put them down as I dictated a report. Immediately after that, up in my office, I put down what thoughts I'd had. And one was, first was, well, I don't have a very good fit with this tube and this cuff because we have a big leak and it's hard really to ventilate and hard to expand his chest. That was one thought, and that was one which led Mac Perry to think we'll do a tracheostomy and get, because he does have an injury and there's an indication for a trach, maybe be able to ventilate better. Well, that was one thought. My next was that he's a bigger man than I thought. Look, he's over each end of this. By this time, I had to, he hadn't been moved to a table. He was still on the gurney, so we had to raise the foot of the gurney to put him in low Trendelenburg position. Next thought I had was, well, he really must have had bad backache, back pain. You know the stories that he had as commander of a PT boat in the Solomons during World War II. He had been run down by, his PT boat had been run down by a destroyer, a Japanese destroyer, which cut his PT boat in two, and he sustained back injury from that. He had been operated on it 3 times in New York because of that. He was laced into a brace, steel brace up his back, canvas lace brace. In addition to the canvas lacing, he had used, or somebody had used on him, 6-inch ace bandages which had gone around his torso, around one thigh, around his torso, around the other thigh, repeatedly till he was tightly laced into this back brace. And I thought at that and looked at it later as people say, well, he fell backwards. He didn't go forward. He shot from the front that pushed him over backwards. Well, that shows a lack of ballistics, knowledge of ballistics first. But second was, I'd say he couldn't have fallen anyway. He couldn't have fallen forward. It's too bad he couldn't. If he hadn't been in that brace, probably that first shot, he had 5 seconds. He could have fallen out of the way of the second bullet. But in that brace, he couldn't fall if he's braced. He fell to the side only when Miss Kennedy got out of the seat and stood up on the back of the car. A lot of people have questioned, what was she trying to do? Was she trying to escape? What was she trying to do? Well, I think she was trying to get out of his way because he started falling that way, bleeding profusely from the head wound. So Well, anyway, he had that big brace on, and I thought, well, how in the world could he have sat in any degree of comfort, laced as he was into that? My next note was, I put down, I wish Miss Kennedy would stay out of the room. She kept circling through the room. She was wide-eyed, she had a 50-yard stare, didn't look like she saw anything, blanched in the face, expressionless. It was really distressing to see her circle through the room. The Secret Service would get her by each elbow and lead her out, and she'd be right back in a minute. And most times she came in, she had her hands cradled like this, left hand over the right hand, and just walking with something in her hands, obviously, because on one trip through she nudged me as she came to the head of a table and handed me a good segment of his brain, which she had been cradling. Oh, that's one of the hard parts of the story to tell. As you might guess, because I just handed it off to a nurse immediately and went back to what I was doing and wished she'd stay out of the room. But at least that was one of my thoughts, and that's what I'd put down about it afterwards. By this time, I was aware that a priest had been allowed into the room. The Secret Service did keep the crowds out of the room. There were just a few other doctors around, and they were on the outskirts. I said that left plenty of room for Ms. Kennedy to maneuver. As a priest came into the room and stood at the side of the door, I turned over my ventilating problems duties to another one of our department staff, and went over and asked a priest the question I think is one I've put in the movie. What's the proper time to declare one dead that you can still do the last rites? That's essentially what I asked him. And essentially what he said, I think was, I checked this on your Marquette theology here, John. I think he said was, well, if we can do the last rites within a short time after the physicians have declared one dead, we think I think he said, it's before the soul has left the body. I'm not really sure what, and I did qualify any statement I wrote about that later. But at least that was enough for me to go back and say, Mac Perry, the chief surgeon, look at this head injury. We don't have a chance resuscitating him. We should declare him dead. The priest is here for the last rites. And we hesitated long enough to decide who was going to declare him dead. We decided the neurosurgeon, who was one of the last ones to come in the room, one doing a closed chest massage. Since it's a brain death, he should be the one to go out and give the word that it was a brain death. It had been due to the bullet through his brain. Oh, and so that's what happened. People disappeared. They just faded from the room. You would think from all reports that every doctor there came up and examined that head very specifically, but they really didn't, I can tell you. They did look at it, I'm sure, because we said, look at this head injury, we can't resuscitate him. But it's been a source for the conspiracy advocates, those writing books, to say, well, the Parkland doctors, no two of them described the wounds the same, so they don't know what happened. They didn't know what happened to him. Well, we've got historical precedent for the fact that we don't all see things the same. Matthew, Mark, Luke, and John differed a little bit in their early writings, and we've been eyewitnesses have been differing in their opinions all the years since. Anyway, with that statement that he's declared dead, our staff disappeared. There was another criticism that's been in, is why didn't the Parkland doctors examine the body and know where the bullets were? Boy, can you imagine turning the body over and looking for other bullet holes with Ms. Kennedy there and the Secret Service there? No way. Plus the fact they don't do that for somebody who's not known. The pathologist does, the forensic pathologist. I didn't leave the room. I was trying to take out the tracheostomy tube. In those days, you removed everything. Today, we send it all to the autopsy lab with the patient. Taking the trach tube out, disconnecting the EKG leads, taking the IVs out, taking the chest tube out. I'd started doing that when Ms. Kennedy came in the room and started at his foot and kissed him on the foot and the leg and the thigh and the abdomen, the chest and the lips, and stood aside while a priest began the last rites. Several Catholic ceremonies I've been to, the priest is going through the ritual, if it's ritual, in such a machine gun staccato fashion that I never understood what was said. And I know I thought at the time, well, I hope he recognized the solemnity of occasion. I shouldn't have thought that, but that's what I wrote later. Solemnity and the importance of the occasion, and I needn't have even worried about it because he certainly did, as he intoned the last rites in a prayer quite appropriate in slow, measured, resonant tones. And Ms. Kennedy stood aside, and I stood aside, and at that, Secret Service moved Ms. Kennedy out. I finished disconnecting things, and they wheeled Secret Service on each side of the gurney out through the door, running down, essentially running over our forensic pathologist who was there, insisting the autopsy had to be done here. State law, places where the murder committed, autopsies to be done there. The Secret Service by this time had no inclination of releasing the body again. They had failed first to protect him from being shot, and they were not going to release. Well, they had specific orders, I'm sure, by that time. Mr. Johnson was already out at the plane, and the rest of the party was to the plane, except for Ms. Kennedy. She wouldn't go to the plane without the body of the president. And I know they had fears that there was some conspiracy, some cabal of assassinators in town, and they all thought they'd be assassinated. That must have been what they thought. That's what I'd give Mr. Johnson credit for thinking, and his Secret Service advisors, that they had better get to the plane. They got the body out. He was sworn in, Mr. Johnson was, and they took off for Washington. Well, that essentially is what happened at that time. Earl Rose, the forensic pathologist, was still arguing that it should be done there, and had it been done, it would have obviated a good part of the material that the conspiracy buffs have used over the years to say that there was something wrong with the Warren Commission report. 2 days later, I went to church, and as everybody in Dallas went to church, I think. Oh, with my daughter and my younger son. My older son was away in college, and we went to an early church service. And then I went to the hospital because I hadn't been able to get in my office. This was Sunday, the assassination on Friday. Ms. Connolly, the wife of the governor of Texas, had occupied my office because the governor was in a recovery room, and this is my office right next to the recovery room. Mr. Connolly, Governor Connolly, by this time was raising Cain to get out of the recovery room. He hated to be in that room without windows. He wanted to go back to the room where he could see out. And he had a severe operation, as you know, with a bullet which had shattered his right fifth rib and destroyed his middle lobe and had gone through his wrist and into his thigh. He wanted out of the recovery room, and so they moved him from the recovery room to a private room which had steel plates over the windows. He still couldn't see out. Secret Service didn't know what kind of conspiracy there was, thought there'd be somebody thinking he hadn't done the job right and he'd be back today and do it. So Ms. Connolly was moving out of my office. I went back to the office to be, I don't know why, to see what had happened otherwise since I'd been there Friday. And while I was sitting in the office, Mac Perry, the surgeon, was there, and he was very distraught, saying, "It's been a terrible week, and my wife and I are going to Padre Island and try to get out of town." While we were sitting there, the same surgeon came in, Ron Jones, and said, "Oswald's been shot." and they're bringing him here. Will you come to the emergency room? Oh, I know my thoughts then were, well, I hope it's somebody from Washington who shot him. Nobody else from Dallas, because we had had enough over the radio already about Dallas being a city of hate. And Mike and I sat there momentarily, or two momentarilies, or three momentarilies before we decided to go. But we did get to the emergency room in plenty of time. And we had a full crew, and they stood around the side. You know, we had the chest surgeon, the neurosurgeon, the urologist, vascular surgeon, and any number of others to start IVs. But we had plenty of time to wait before Oswald got there, because I showed you that picture. The ambulance couldn't get out of the police car, couldn't get out of the basement of the police department for the newspaper people around taking pictures. And so when he did get there, he looked just like Mr. Kennedy looked the day before, except he didn't have a head injury. He's one that we should have resuscitated, according to my earlier thesis here. But Jack Ruby did a good job in where he placed the gun, right in the, as he put it, right against it. Anterior axillary line, about the 6th interspace, which went through the left lobe of his liver, through the diaphragm, through his aorta, through his vena cava, through the right lobe of the liver, and into the right kidney. We've resuscitated a lot of patients who had an aortic injury with a gunshot wound or a vena caval injury, but I'm not sure we've to date have resuscitated one who had both transected by a bullet before they were brought in. So his circulating volume, which should have been circulating, was all in his peritoneal cavity. Nevertheless, he had a chin jerk, and he had a dying heart pattern, and we got him intubated and got, within 12 minutes, we'd given him 3 liters of lactated ringers, 2 units of universal donor blood, so-called, had put a chest tube in and had IVs started, catheter in his bladder, and had taken him 2 floors up to the operating room. That was 12 minutes we spent in doing that, and started the operation, had the abdomen open in that time. His wound was great. We did get his cardiac activities back pretty well. And then it started fading, and dropped, and then we couldn't resuscitate. Couldn't get his heart defibrillated, couldn't bring it back. Well, I guess it had too long a period of anoxia to his cardiovascular center, his respiratory center, and too much edema that we did get immediate results, but not sustainable. And so we pronounced him dead after an hour and a half.